so I'm getting started. Oh, so here's my note card. All right, so knock, knock, knock. Say, come in.
Come in.
All right. So I'm washing my hands. All right. Good morning. My name is Tawana. I'm a student nurse and I'm here to do your physical assessment today. How are you doing?
I'm doing well.
Okay, can you tell me your name and date of birth?
First name Shamar, last name Brad, and the date of birth is 0806
Oh,
2000.
okay. All right. Nice to meet you, Mr. Bradshaw. Do you know why you're here today?
For a physical assessment.
Okay, and can you tell me today's date?
October 11th.
All right, awesome. Can you tell me who the current president is?
Yes, it is Biden.
All right, and okay, awesome. So the patient is accommodated. I mean, not accommodated. The patient is oriented. So I'm gonna check your accommodation. I'm gonna check your pupil reaction and stuff. And so I just want you to look, don't move your head, just look at me, and I'm gonna shine this light in your eyes, okay?
Okay.
All right, keep your eyes open. Okay, awesome. Pupils are equal, round, and reacted to light. Okay, so my pen, don't move your head. I just want you to follow my pen with your eyes, okay? All right, so I'm gonna do an H shape. Follow me, pen. Okay, patient is accommodated. Dang, I ain't got my camera right. All right, so, okay, so now, sir, I would like to, I'm gonna put some gloves on so that I can check your, head. Have you had any pain or any discomfort in your head recently?
No.
No? Okay, so I'm gonna palpate your head. What did I do with my card? Oh, it's in my pocket. Okay, so let me know if you feel any discomfort, okay? Okay, so I don't feel any lumps, and the hair is clean. There's no lumps noted in the head, okay? I'm gonna take these gloves off now. All right, so now I want you to hold your head back so that I can look in your nose, okay? Okay, the nose, there's no nodules in the nose. Can you say ah? Open your mouth. Say ah. Okay, the oral mucosa is pink and moist. Okay, let me look in your ears. Have you had any ringing in your ears lately, sir?
Nah.
Okay, look over here. Okay, there's no drainage in the ears, and the patient states that he has not had any pain. And did you have any tenderness in your head when I was pressing down?
Nah.
Okay, great, awesome. All right, so now I want to palpate your lymph nodes. So I'm going to palpate your neck. Let me know if you feel any tenderness. Hold your head back a little bit. Okay, so this don't feel right, but okay, so you don't feel any tenderness, right? Okay, so I'm palpating the thyroid, palpate the trachea. Does that hurt any? Okay, awesome. And palpate the neck, and then the thyroid, I'm supposed to stand behind you and let me palpate. Okay, all right, no pain or tenderness, right?
No.
Okay, awesome. So I'm gonna palpate carotid arteries one at a time. Why is this? I hope this recording. Okay, I'm gonna palpate them one at a time. Okay. All right, no abnormalities noticed. All right, so now I'm gonna feel the patient lymph nodes. I'm gonna start with the preauricular, which is right in front of the ear. Let me put this paper down. Okay, the postauricular, right behind the ear, the bioccipital, which is right back here, retropharyngeal, the hold your head up, please. The submandible, right under here. Submental is under the chin. The anterior cervical, can you sit up for me, sir? Okay, awesome. And the posterior cervical. Okay, all right. the lymph nodes are non-palpable. So now I want to check your JVD. So can I get you to just turn your head from side to side? Over some? Okay, awesome. Okay, no distension on that side. Can I look at the other side? Awesome. Okay, no distension noted on that side either. All right, so now I want to compare the carotid artery and the radial pulse. So can you hold your head back? Oh, well, you don't have to hold. You can just sit straight. And then let me see your radial pulse. Okay. I'm comparing the carotid artery and the radial pulse. It's bounding. All right, awesome. So now, I would like to listen to your carotid arteries. My bad, just tangled. Hold up. Let me shut up, Troy. Okay. All right. All right. Whatever. I'm listening to the carotid arteries. Oh, yeah. Okay. Okay. No swooshing or abnormalities noted. I don't hear any abnormalities. All right, so now I would like to, I'm gonna take my tongue blade out. Is this recording? Oh my gosh. Okay, so now I'm gonna take my tongue blade out and I wanna test your gag reflex. So can I hear you, can you say ah? I'm sticking the tongue blade in your mouth. Okay, the gag reflex is working. So that's cranial nerve 9. All right, so now I want to check cranial nerve 1. So I would get some different smells, and can you put one hand over one nostril and then just tell me what you smell? What do you smell?
Cinnamon.
Okay, now can you put your hand over your other nostril and tell me what you smell?
Lemon.
Okay, awesome. So cranial nerve 1 is working, and then cranial nerve 2, before the patient came into the room, they did eye check. They checked his eyes with the Snellen chart, and your eyesight is 20/20, so you have good vision. And they also checked your vital signs before you came into the room, and all your vital signs were normal, okay? All right, so now I want to test cranial nerve 5 and 7. So I'm going to touch your face with, I would touch your face with, I'm going to touch it with this. So this side is smooth and this side is sharp, okay? So just let me know if you feel this. Do you feel this? You feel it?
Yeah.
What are you saying? Okay, so cranial nerve 5 and 7 is working. Okay, so can you smile for me?
Yeah, sure.
Can you please smile for me? Okay, and can you frown? Awesome. All right, now I'm gonna test cranial nerve 8 to see if your hearing is working well. So I'm gonna do the whisper test, okay? And you just tell me what you hear.
Okay.
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 Okay, so did you hear me well?
Yes.
Okay, so cranial nerve 8 is intact. The patient heard me when I was whispering. So now, sir, I would like you to stand up because I would like to check your gait.
Okay.
And okay. Can you walk that way?
All right.
And can you walk back towards me?
Okay.
Okay, so the patient doesn't have any gait. The Rumberg test as well. So can you sit back down for me, please? Can you touch your shoulders for me with your head? Can you move your head side to side with touching your shoulders? And okay, awesome. Cranial nerve 11 is working properly because the patient was able to touch shoulders. All right, so sir, now I would like to ask you. No, I want to listen to your heart sounds right now. Okay. So I am going to start with, so you have the aortic valve, pulmonic. So the aortic is located at the It's the right sternal, second intercostal space. And then we got the pulmonic. It's going to be on the left sternal border at the second intercostal space. And then Erb point is third intercostal space on the left side. And then 8 to 9. So then we got aortic, pulmonic, Erb's point. The tricuspid is going to be the fourth intercostal space on the left sternal border. And then we got the mitral valve, which is fifth intercostal midclavicular. So are you ready? Okay. So we're going to start. Let me get my card in my hand. All right, so we're going to start. Aortic valve, second intercostal. I'm on the right hand side, right sternal border, second intercostal space. Okay, so now I'm going to move over to the left sternal border, pulmonic valve, second intercostal space. Now I'm at Erb's point. I'm at the third intercostal space on the left sternal border. And now I'm at the tricuspid, fourth intercostal left sternal border. And now I'm on the mitral valve, fifth intercostal left midclavicular. Awesome. So now I want to check your apical heart rate. And I'm going to auscultate the apical heart rate for 1 minute with the patient leaning forward. So she said I don't have to do that. Okay, so now I want to listen to your respiratory pattern, okay? So I just want you to breathe normal, and I'm just going to listen to your breath sounds. So I'm going to listen to the breath sounds anteriorly, 6 places, and I'm also going to listen to the lateral side, and then posteriorly I'm going to listen 8 points, and I'm also going to listen to the lateral side. So are you ready? All right. So let me turn this back on. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, I'm down to 6, 6. And then I'm going to listen to the lateral side. Put your arms right beside you. You know, listen over here, lateral side. Okay, and then posteriorly, I'm going to listen 8 points on the back. Start on the right hand side. 1, 1, 2, 2, 3, 3, 4, 5, 6, 7, 8. I'm also going to listen to lateral breath sounds on both sides. Okay, so breath sounds is normal respirations, and they're not labored, and I didn't hear any wheezing or no breath sounds that was abnormal. I didn't hear any of that. So now, sir, can you tell me when was the last time you voided?
Last time
Last time you urinated.
Oh, about 30 minutes ago.
Okay, and when was the last time you had bowel movement?
Probably about 4 or 5 hours ago.
And can you tell me Like, is it a color normal? Was the urine yellow?
Yeah.
Okay, and bowel movement, normal colors?
Yeah.
Okay, no pain or difficulty?
Nah.
Okay, so, now I want you to lay down for me because I want to check your abdomen. Lay down. Oh my gosh. Okay, I can barely see. Okay, that's fine. Let me see if I can move my camera down. Okay, good. All right, so, and when I auscultated the breath sounds, you don't auscultate through clothes. You auscultate on bare skin. And when I listen to the heart sounds, I didn't have him take his shirt off or anything like that, but I would do all of that on bare skin, not through the clothes. So as far as the abdomen goes, first I would inspect the abdomen, and I don't see any abnormalities. Then I would, you don't have any pain today, do you, sir? Okay, so since there's no pain, I can just move through in my normal mode. So first I would inspect, and then after inspection, I'm going to percuss, okay? And let me know if you feel any pain, okay? All right. Any pain? No. No pain? No pain. Okay, all right. So now I'm going to palpate and let me know if you feel any tenderness, right? Okay. So I'm starting in the right lower quadrant. Any tenderness? Up, left, right upper quadrant. Left upper quadrant. Left lower quadrant. Okay. So now I'm going to auscultate. Can't even talk. Now I'm going to auscultate. Start in the right lower quadrant. Right upper quadrant, left upper quadrant, left lower quadrant. Okay, awesome. So, bowel sounds are present within 5 seconds. So, bowel sounds are normal. Okay, so now, sir, since you're laying down, I want to test your range of motion in your upper extremity. So can you put your hands on top of your legs for me?
Yeah.
Come on. All right, and then can you just tap your legs like that? Okay, awesome. All right, so now can you move your hands up and down one at a time like this right here? Okay, and then can you like do it like this right here? Okay, so range of motion are normal in upper extremities. I'm gonna check his capillary refill. Bless you. Are you okay, sir?
Yeah, I'm doing just fine.
Okay, can we continue?
Yes, sure.
Okay, lay back down. All right, so I'm testing his capillary refill, and cap refill is less than 3 seconds in his fingers. All right, awesome. So now I want to check your radial pulses first. And check your radial pulses. Radial pulses, they're bounding, +2. I'm going to check the brachial pulses now. Brachial pulses are bounding, +2. Awesome. So now I want to check your range of motion in your lower extremities. So okay, so I want you to put your legs straight out for me. And then can you push against my hands? Okay, awesome. And can you kind of like just kick your leg out like you're doing a little dance for me? You can kick it out straight. Okay, good job. Okay, the range of motion is functioning properly in the lower extremities. All right, I need to check your capillary refills in your toes. So I would have him take his socks off so that I can check his cap refills in his toes. And the cap refills are less than 3 seconds in the toes. There's no edema noted on the legs and the lower extremities. There's no bruising. The skin is warm, dry, and intact. And his upper extremities, the skin was warm, dry, and intact in the upper extremities as well. Are you needing to blow your nose, sir? Okay. The skin was warm, dry, and intact in the upper extremities as well. So Sir, I want to thank you for, I'm not in the camera. I want to thank you for letting me do your physical assessment today.
Yes.
And if you need anything, you know, my name is Tawana, and you feel free to call out. The doctor will be in shortly to release you.
Thank you, Mr. Warner.
All right, awesome.